Well, hello everyone. This is Dr. Amig, your friendly rheumatologist from Unabridged MD. Today, I am so excited to have an integrative medicine doctor, Dr. Malathi. I'm gonna have her introduce herself very soon. A couple of things is that our retreat is coming up the first day of the fall. It is a Saturday. We have half a day together to set up intention and make sure that we jump into the fall with the best intention so that we can get the best of fall. This is our first retreat with Unabridged MD. It's with Ceres, who's both a Tai Chi master as well as an acupuncturist. So she knows a lot about the Qi and all of those things. If you are interested, you can actually look onto the website and register. So it's at unabridgedmd.com. And if you want some information, you can also do info@unabridgedmd.com. All right, without further ado, let's talk with you. Dr. Malathi, thank you so much for coming on the show. It's such a pleasure to see you, to have you here. I would love for you, so you're an integrative medicine doctor. I would love for you to tell us your journey. Tell us a little bit about you.
Dr. Amik, I am so excited to be with you here today and to be in conversation with you. Thank you for this opportunity. I'm passionate about integrative medicine, and I know that your podcast over the years has focused on so many aspects of integrative medicine. So I really consider this as an honor to be here conversing with you about a topic that I know you're passionate about, and I am too. So I'm an integrative medicine expert. That's how I call myself. Um, I I'm also board certified in internal medicine, and I was a primary care physician. I worked in the traditional Western system. You know, when I say traditional, it's a Western allopathic system of medicine for almost 20 years. The initial part of my career, I was a hospitalist, seeing really sick patients, getting them better, getting them out of the hospital, and that churn and the cycle. Then in the last 6 years of my career in the traditional allopathic medicine, I became a primary care physician. And when I became a primary care physician, the panel of patients that empaneled with me were younger patients. And they were, Asians, Chinese and Indian patients. And they would always ask me, they don't like to take medications. And they would always ask me, what can we do other than medications? What can we do things naturally to help? And, you have to understand, I was a hospital doctor who became a primary care physician. So I was like, what do you mean by doing things naturally? That's what I would think in my head. But in the course of that first year as a primary doctor, I kept hearing this question again and again. I'm like, so many of my patients are asking me, there is truth to what they're asking me. So that's when I started exploring other things. How can I give the tips that my patients are asking for? Yes, I'm very good with medications and everything. But so then I looked, I did a lot of soul searching, and I found this, and I really did a lot of research, and I found this fellowship that I ultimately joined and completed at the Andrew Weil Center for Integrative Medicine. So that was when I understood that, yes, there are a lot of things one can do naturally because the body has an innate ability to heal. And there are so many things we can do to aid that mechanism, to kind of rekindle and, aid that mechanism. And, that was a moment of revelation for me, and it just changed my perspective. The thing about integrative medicine is, we need to spend time with our patients. This is not something that it can be done in 15 minutes. This is a multidimensional approach. We delve into not only physical symptoms, but emotional, spiritual, mental issues that they're dealing with. And I very soon realized that the traditional system where I was an employed physician, that did not give me the luxury of spending time with my patients. So that is when I left that career, left the job, and I started my own practice. I founded Ayur Integrative Medicine, and I have my own integrative medicine practice. So, and the other thing about integrative medicine is that I did this fellowship from August 2020 to, August 2022, at the peak of, when COVID started and at its peak. And as I went through the different units, the chapters and the curriculum, I would pick one or two things and I would implement it for my own personal life. It's the first chapter talks about spirituality, and they said, hey, there's a lot of research evidence that shows prayer meditation really helps. So I started doing a prayer meditation, and it was COVID times, and it really helped me. So I would pick one or two things from each unit, and I added that to my life. I started doing yoga regularly. I started implementing all the nutritional changes I read about, and I can tell you that those are the things that help me not burn out. If I was able to function well and help my patients during the worst of those times, that is because of what I learned and put into practice, as an integrative doctor. So I feel like this is something I benefited immensely from. It is my duty, it is my responsibility to take it out to everybody so that they can experience this.
Mm-hmm. This is wonderful. There are so many gold in what you've just mentioned, and I want to dig a little bit here. So the first thing is, from your definition, integrative medicine is basically a medicine that looks at the person fully. And it sounds as if you need a fellowship to really learn more about what integrative medicine is. Can you tell us a little bit, how do you define integrative medicine for someone who doesn't know anything?
So the way I would define it is, it's a multidimensional approach. It combines treatments from the traditional Western medicine with treatments from other ancient systems of medicine, that have existed for years, like the traditional Chinese medicine or Ayurveda, be it homeopathy, naturopathy, also from not not just the traditional, age old traditional systems, but from chiropractic, osteopathic manipulation, you know mind body medicine, things like that. It combines all relevant treatment measures that have been known to help in the past, and it combines them in a science evidence informed way, because we have to be very mindful that some treatments may not be indicated and some treatments cause harm. So that is the distinction. Now we have to be mindful of what can cause harm, so it has to be informed by evidence. And integrative medicine combines them in an intelligent way, incorporates all of these things in the treatment plan for the person. Yes, Western medicine is important, don't get me wrong. Is invaluable, but by itself it's inadequate, because the body needs so many other different
Mm-hmm.
aspects in the journey of healing and in the journey of wellness.
Mm-hmm. I really like what you're saying. So I think, number one, as a patient myself, that's really what I experienced, meaning that I felt that Western medicine was extremely powerful. And at the same time, it wasn't enough. And I'm absolutely certain the reason I'm here is thanks to the Western medicine, but I'm also, it's a little bit presumptuous to think that I'm also here because of all of this work that I did on my mind, my body, and my spirit. That included, the meditation, the yoga, the climbing for me, and so on. So I really like it. I hear a lot on what you're saying, that you felt that Western medicine by itself is inadequate. Um, can you tell us a little bit more? Yes, there are some patients who do not want to take medication, and I see that all of the time, and I always try to figure out what's in there, because I also feel that we are in 2023 and that there are a lot of really good medication with less and less side effects. And it's as if we were saying, oh, no, I don't want the cell phone. Like, I'm not going to take an iPhone or, a smartphone because I don't want to. I'm just going to take a phone, I'm just going to take one of those rotary phone. And you're like, well, hold on. Like, yes, there are some bad things about it. And you can, looking too much at social media is not great. Yet there is a lot of value in the cell phone, in the smartphone that we have nowadays. And so that's
Mhm.
really how I see Western medicine. It's like there are still so much value in what we have to offer to our patients. It like it sounds to me that what you're saying is that it's not enough. You know, could you tell us? And then there's a lot of sun for the for the tree. I'm sorry, I'm trying to move. But tell us a little bit. So this show is on hope driven by science. Can you tell us a story of hope, like that from your experience as an integrative medical doctor, you saw where you're like, you know what, like this is thanks to my integrative medicine background that this patient did so well.
You know, even in the system where when I was practicing, where I didn't have much time to spend with patients, we know that, you know, for even common disorders like, obviously we know for diabetes and high blood pressure, diet and lifestyle, and a lot of mindset work and putting into practice meditation and other tools help. But here is a thing. So even for conditions like depression and anxiety and mood disorders, we know that it's all related to what we eat and what we do and how much we move. So there, there were, I had a young patient, software professional, in the busy Silicon Valley, living away from her own family, living thousands of miles away from her family, doing this stressful job, which involved, you know, phone calls and at odd times. Software engineers, I practice in the Silicon Valley, so that is a common scenario that I encountered. Not only physicians, but they have odd time phone calls and meetings because they collaborate globally with teams all over the world. And who had come in with feeling down. My mood is down, I don't feel like doing anything, I'm tired all the time. uh, you know
Mm-hmm.
Test showed pre-diabetes. So this was a patient that I used all the skills that I had as I learned as an integrative medicine doctor. We, everything could not be done at, there are 15-20 minute restrictions, but, even in that time, is talking about spirituality practice, hey, you know, explore that. What does it mean for you? Explore it. Your body is undergoing a lot of stress from the lifestyle, from your work. So why don't we talk about what relaxation practice, relaxation, what can you do to stimulate that relaxation response? Meditation, breathing, that would counter the chronic stress that her body is feeling. And let's go a little more in detail about the diet. And when we talk about diet and nutritional changes, we have to be very I wanted, knowing the background, knowing their ethnic background, their food preferences, I was able to work with her to give her very specific, you know, recommendations according to her taste and what she likes to eat, and culinary preferences, and you know cultural preferences. And it we took a while, but she just implemented these few changes. And the change, after 2 or 3 visits, when I saw her, she was so dramatically different. And as she walked into the room, I could make out, she was smiling. There was this positive energy and smiling. And she said, I said, what happened? What? So, I just did all the things, the few little, things that you told me to, doctor, and I'm so different. You know, I'm so different. I feel different. I'm happy. She
Mm-hmm.
told me that I would, I feel like crying all the time. I don't know why, but I would feel like crying. I would break down in tears. She told me, Doc, now I'm feeling all energetic, happy. Really, I feel like I can do what I need to do at my work and balance my life. So it's all about taking the, being present there. Taking our full presence to that visit with the patient. Um, Giving them the time, listening to them, and then putting together this multifaceted plan that works
Mm-hmm.
well.
Yeah,
Yeah.
this is really a beautiful story. I would argue that it's because you are Western medicine educated doctor, that you can almost bring even more to your patients because you have done the integrative medicine, also fellowship, because you can say, okay, this is not dangerous. I mean, yes, it can lead to more dangerous things, but at this time, right now, there's nothing that Western medicine has to do for you. Like, it's not like you have a heart attack or you have lupus or, rheumatoid arthritis, like all of, my rheumatologic conditions. And those are all of the things that you can do to help yourself. And I say this all of the time to my patients. I'm like, there is all of the things that Western medicine can do, and then there's all of the things that we can empower you to do. So I really love this approach that you have. So you mentioned that you work in Silicon Valley. Tell us where we can find you.
Yeah. You can find me on my website at www.ayur.today. I'll spell that. It's AYUR.today. Ayur in Sanskrit means life. So, and I have 3 locations in the Silicon Valley, the Bay Area, Northern California. I see patients in 3 locations: Pleasanton, Portola Valley, and Menlo Park. And Dr. Amig, I want to along with you there, I want to agree with you on this and reiterate this. Integrative medicine does not put aside Western medicine. Western medicine is invaluable. In cases like, people in your area of specialty, rheumatological conditions, in cancer treatments, we cannot discount the value that the traditional Western treatments bring in. What integrative does is it brings in much more to address the whole person healing. Absolutely. Yes.
Yeah, I love this. It's funny. I almost want to leave this here. Someone asked me, I don't know if you are aware, but there's a recent study from the JAMA. So it was at the JAMA journal that showed that surgeons who are women, compared to their male counterpart, have patients with better outcome. And I think it's at 3 months. I can't remember. Anyway, so it's serious. It's like, okay, well, clearly, if you have a surgeon that's a female, you have more chance of doing better. I think it's at 1 month and then at 3 months. We have to look at this. And someone asked me, they were like, why is that? Why do you think that is? And like, talking with a lot of people, right, on the podcast, actually, if you look, there's a lot of women that I interview, a lot of women physicians that I interview. And it's like almost all of them are realizing that Western medicine by itself, if it's just to do numbers and back to back to back to back, and basically like any sort of robot can do what we do, right? Like you put a symptom and then Google, like Dr. Google. I mean, that's not true, but we could almost argue that we could create an AI that's going to do this. And I think it's women realize the power of true healing, and that the true healing really is emotional. And so this is when you really look at it, the emotional intelligence of women, and this is a big thing, and I'm sure there are men that are wonderful, and I know that there are men with a lot of emotional intelligence, it's very interesting to realize that women who embrace this, because that's part of us, because that's how we are, taught and educated, this helps our patients. And to embrace it even more, like you are doing with doing integrative medicine, or my approach of holistic medicine, or the approach of many of our colleagues, is just, it excites me, because it's really what we're seeing from a scientific point of view, where even when it's come to surgery, when really, like, you don't really see a lot of the surgeon after I've had surgeries. I didn't really see a lot of surgeon. But to just realize that maybe there is like a look, maybe there is a question that person has said, as asked, that's enough to make a change for our patients. And like, I just want to leave people on that. It's scientifically proven at this point, that it's not just a transaction, it's not just a medication, and it's not just a surgical procedure, because this surgery study is just the follow-up of an internal medicine study that I've been done 5 years ago, 5 years ago, and where they found that internal medicine docs that were women had better outcome for their patients. So huge, right? Huge.
it's the intention to bring into healing, because healing is, yes, it's medicine and AI and a lot of non-human tools that are going to help us and that are into the play now. But it's the intangible aspects, our intention, presence, listening, empathy, the words that we use. There's so much that goes into it.
Yeah, that's wonderful. Well, Dr. Malathi, thank you so much. We will put all of the info so people who are in the Silicon Valley or who want to visit in the Silicon Valley and feel that they need your help can actually see you and find you. And Dr. Malathi is a woman and in addition an integrative medicine doctor. So if you see her, I'm pretty sure your outcome is going to be phenomenal. So highly recommended. And thank you so much for being on the show. And everyone, I will see you next week. Bye-bye.
I enjoyed our conversation. Thank you for having me, Dr. Ami.
Thank you.